I'm Mark Robertson, back with you here on Mark Robertson Talks. Today's topic, a broad one: poverty, the welfare state, and how the government involvement in so-called helping people has really hurt so many things. The great founder and framer of the Constitution, James Madison, warned about the federal government being involved in what he called benevolence. He said there was nothing, he pointed out, he basically wrote the Constitution, so he knew that there was nothing in the Constitution that allowed for the federal government to be involved in charity or anything along those lines. It's just unconstitutional. There are very specific enumerated powers how Congress can spend money, and the welfare state was not one of those. And so today we've gone so far away from that, though. It's just pathetic, and it's actually un-American, anti-American. And here we are, though, and we have this major, massive welfare state in the United States. It basically started after the turn of last century. FDR really greatly enhanced it and brought it about. But one of the major points in the welfare state was the, in my opinion, totally failed war on poverty that LBJ brought about in 1965. And a little known secret is that up to that point, from just after World War II to the mid-60s, poverty was declining steadily from about 30% in 1950, all the way down to where it was when the war on poverty started, just low double digits. And it's basically hovered around that amount or that rate from this point on, where we are today, despite spending $22 trillion in the so-called war on poverty. Now, many in that effort had good intentions, but a lot of people didn't. It was about power and control. It's like everything else. The many on the left want to control people, so they'll vote Democrat for their pittance. And the welfare state in this country has brought great harm to the family, especially the African-American family. It has decimated the African-American family. What it essentially did is it paid women more to have babies as long as the father didn't stick around. A total recipe for disaster, and disaster has happened. Our inner cities are war zones. These kids growing up without fathers and uncaring mothers they have who don't know how to raise kids, have no means to raise kids hardly, and they just turn to gangs to meet their familial needs. And thus our inner cities are chaos, many shootings every weekend and during the week in these major cities. And it's just really dysfunctional. And in my opinion, it's largely brought about by the totally failed war on poverty. Now, yes, there are other factors, diminished morality that being taught by the Bible and things like this. They've gotten away from traditional morality. So before the war on poverty began, the out-of-wedlock birth rate in the African-American community was just over 10%. Now, after 55 years of the failed war on poverty with totally bad incentives, it's now over 70%, in some areas well over 70%. And so it's just a disaster. It's a cataclysm for these families, these inner cities. They've had generations trapped in the welfare state. And in my opinion, the welfare state is like the new plantation. It traps all these people, oftentimes African Americans, on the welfare plantation, and they'll keep voting Democrat for their pittance. And that's all they know at this point. And so the welfare state is really not new to the United States, though. Many people credit Otto von Bismarck in Germany in the 1800s for getting it started. He was all into this Social Security and benefits and healthcare and things like this. And it was basically a disaster there as well. And it led to all sorts of chaos, as you know, in Germany later on. And so it never works. The government involvement in helping people, the federal government especially, is always a disaster. Just getting a check from the government doesn't help anyone. It hurts people. It brings harm. It brings chaos. And but these people know that. A lot of times these despots in government, they know that, and they do that by design. They want to get people under their thumb, so they know if they can promise them something from Washington or wherever the capital is, that they'll continue to vote for them. It's all about power. It's all about control. And despots have been this way throughout history. Now, if you actually want to get involved in helping people, what's the best way to do that? If you're just going to throw politics out of the picture, the best way to do it is, of course, private charity. And it was done that way before the welfare state came about, especially in the 1930s. Private charity holds people accountable. It knows the people quite often to help them. It's just a temporary stopgap. It's not supposed to be a lifestyle. It's not supposed to have 2 or 3 generations on the welfare state or on the welfare rolls. And they would encourage people. It's often claimed by the left that if we turn helping poor over to private charity, that they can never make up all the difference. Well, the difference is that the welfare state has actually increased the number of poor people. And before the welfare state came about, there was a great stigma about being on welfare, even from charity. And so people did their best not to have to be on welfare or receive any help or assistance from anyone. People were individual, they were self-reliant. Now, yes, neighbor was helping neighbor, farmers would help each other put up a barn or with harvesting and things like that if someone was sick, or even if they weren't. They would help with harvesting. It was just kind of a mutual society where they helped each other. But the welfare state has gotten in the way of all that. That's another way it's caused damage. It's brought people apart. It's separated people. And it's just created chaos from the very beginning. And it's back in the early part of the century, there weren't many people on the welfare rolls. As late as 1931, there were 93,000 families on what was called AFDC until recently. But today, those programs are now $26 billion a year, and for federal and state paying it together. It's crazy. It's out of control. It's an incentive to get involved in welfare. Even after welfare reform in the 90s, which did help, people are still trapped by the welfare state. It's been nothing but a disaster. And the answer for poverty is private charity, but it's also a strong economy. The best anti-poverty program is a job, as Ronald Reagan said. And a strong, roaring economy not only brings jobs and lifts living standards, it also provides people with more resources to give to charity and to have time to help other people. So a strong economy helps poverty in so many ways. That is the best answer for poverty. But the bureaucrats and the despots who run know this. They don't even want a strong economy. They want to keep people down, and they want to keep people trapped and dependent, so they will continue to vote for them. So they bring about policies. It's a given, people think, that both parties want a strong economy. Well, that's not the case. The Democrat Party of this country doesn't want a roaring, strong economy. They want to hold people down so that they'll vote Democrat, and they want to control them. And they want to control their families and the generations to come, and that's what the welfare state does. But getting back to my point, what was the situation before the welfare state? How did they help the poor? Well, of course, like I said, there were people helping people. There were churches. There were also many fraternal societies, the Knights of Pythias, the Sons of Italy, the Polish National Alliance, the Independent Order of Oddfellows. In 1920, there were over 10,000 fraternal orders. In the U.S., there were 100,000 separate lodges, and 18 million American were members. Now, what were these organizations? They were organizations where you would pay a small amount in dues every year, and these organizations would also provide direct health care for their members and their families, and it was dirt cheap. And they'd often have a doctor on board who would see the families and the members of these organizations, and they would hire them. And they really got health care for next to nothing. So it was really a great operation, a great idea to do things. And they had the goals of just being a mutual aid society is what they call them. It was like insurance for the welfare of society. And they were all privately run. The government didn't have anything to do with them. And they were lodges. They were organizations where people would meet for fellowship and things like that. Organizations like this, of course, they provide the health care and even things like that. But they also provide the support, the fellowship support that people need so much as well. So it was a win-win on so many fronts. It was low cost. People encouraged each other. They supported each other. And the welfare state, the government welfare state, got in the way of all that. It brought great harm, and it basically phased them out. There are still some organizations today, the Knights of Columbus and things like that. But back then, like I say, that was just a normal way of life. Even in the 1920s, in the city of New Orleans, there were 600 fraternal societies among blacks in New Orleans. And they were able to get medical care, things like that, to doctors. And in Mississippi, there was a fraternal hospital, or fraternal hospitals, plural. and they were paid just a few dollars a year. And these African Americans or blacks, they could get, a lot of times they were sharecroppers, but they could get their health care for not much, not just a few dollars every year. And so things like this really worked, and they helped people. But you know what? There's not a lot of money involved in that. And the healthcare industry tried to put a stop to it, and largely they did. The American Medical Association and other groups, they wanted that money. They thought there should be more money in healthcare, and so they basically forced them out, and they even threatened some doctors who were involved in those. No, you got to get these people to come to us and pay us more money. And even back then it was just direct pay, but even then it was more money. So it was basically going on a very small amount to even just a little larger that they would directly pay the doctors. That was even before insurance. That was before going to a doctor, where you'd have these co-pays and things like this, where no one knows how much they're paying for anything, which is crazy in itself. And but so healthcare has exploded. You got Medicare, you got Medicaid. Now they cost over $1 trillion a year combined, and they're heading quickly. They're both about $700 billion, heading quickly towards $1 trillion a year individually. Well, but you got more and more doctors not wanting to take Medicaid and Medicare patients because of inferior reimbursements. Well, where does all the money go? Well, that's part of the problem. It's a thing called Gammon's Law. Milton Friedman talked about that. The British Health Service, the disastrous British Health Service, was taking in more money from the government, but not getting a bang for their buck, and they were wondering where all the money was going. Well, a guy named Dr. Gammon did a study and basically said the more money you put into government health care, they expand the bureaucracy, and that's where the money goes. It doesn't much go directly to help the people. So it's a disaster. The private healthcare system is the only thing that works. The free market, I mean, it's doctors providing services, and that's the best way to work. It's not perfect, but the free market, the fee for service, things like this, direct pay, we got to get back to direct pay, whether it's health savings accounts, the third-party insurance pay, whether it's public or private, is another reason why healthcare costs are so much, because we don't know what we pay for it. And so healthcare has gone from these mutual aid societies costing very little to now being out of control for so many reasons. Government involvement, third-party pay, and things like this. Back in the World War II, Franklin Roosevelt put on wage and price controls, and there was a shortage of employees back then because many of them were in the war. So they also passed that health insurance could be deducted, and so these companies started offering health insurance. And today, most people get their health insurance from their work because of that. And a lot of people are happy with it. 160 million people in the United States have health insurance from their work, and they're happy with it. But even that, it's not the best way to go. It's still buying individual health care is the best way to go. It's the most affordable, and it would keep health care the cheapest. We need individual accounts and medical health savings accounts, and where you can pay directly and have a high deductible for catastrophic. That's what's going to bring healthcare costs down. And we got to revert back to that. These mutual aid societies, we got to get government out of healthcare. We got to get it out of the welfare state. It's causing major problems. It's nothing but a problem. The welfare state has been a major problem in this country. It's dragging this country down. It's trapped people in cycles of dependency for generations, and it's never worked throughout history. And so we go forward, but the answers are private charity. Now, there's a number of people who've written about this and about these civil societies and these mutual aid societies. And one of them is David Beto. And he's got some books out called From Mutual Aid to the Welfare State, Fraternal Societies and Social Services, 1890 to 1967, just after the war on poverty started. And he's got another book, The Voluntary City, Choice, Cooperation, and Civil Society. And those are both very good books to tell you what the actual situation was helping the poor before the welfare state, and it was a much better way to go. So there are other couple books here I've got as well. The great Alex de Tocqueville, of course, he wrote the Democracy in America, his famous book, but he also has this memoir on pauperism, and where he talks about at that time the most powerful, wealthiest country on earth was England, and but they had one of the largest numbers of destitute people. living in poverty. And that's because of the poor laws. They basically incentivize people to live in poverty like we do in the United States. So human nature doesn't change from back then to now, but this is a very good book on that. It's not a very thick book. It's a small book, not like Democracy in America, but it basically says the same thing, that if you subsidize poverty, you'll get more of it. And of course, a famous book on American compassion and welfare state, The Tragedy of American Compassion by Marvin Olasky. And it's a famous book. It talks about these mutual aid societies and how people were helped back before the welfare state, and how it was a much better situation, and how we have to return to it today. And that's the best way to do it, whether it's today or it's way back in the 1800s. Mutual aid, neighbor helping neighbor, the private charity organizations, that's the best way to help the poor. Not this bureaucratic welfare state that has caused so much damage to this country, much of it by design, as I was saying. So there's also Charles Murray's book, Losing Ground. He basically talks about the horrors of the welfare state and how it's basically broken up the family and all the bad things it's done. It's not ever worked. It's a disaster, and that doesn't work. It's got to go. The welfare state in this country has got to be phased out, or our country will be phased out. I mean, we have a lot of other things that we talk about, Social Security and other things like that they're not effective either. If you would put the money that we put in Social Security into even a decent private investment, the return would be so much greater. You'd almost be better off putting your money in a bank for 1%. At least you'd have something to show for it. And so that's another scam, a Ponzi scheme as they call it, and it's broke as well. Medicare is broke. Medicaid's broke. They're all broke. They don't work. Medicaid is a disastrous system that betrays the poor. It harms the poor. It doesn't work. And the poor were so much better off before Medicaid came about in the 1960s as well. It was another LBJ disaster. The Great Society was a disaster. Amity Shlaes has a new book out as well, simply called Great Society. She does a great book on the Depression in the 1930s as well, called The Forgotten Man. And these are really good books to tell you what FDR and LBJ were all about largely. It was largely about controlling people. The Depression was brought about by failed government policy. It wasn't brought about by the free market out of control. It was brought about by failed government policy of high taxes, high regulation, starting the tariffs, the Smoot-Hawley tariff and things like this, that just got in the way of the free market. And these despots, even like Hoover, he may have been a decent guy, but he didn't know what he was doing. He put all these wage and price controls, the Smoot-Hawley tariff. He raised taxes immensely after Harding and Coolidge had cut taxes. So policies have very specific effects on the economy. And that's why we had a depression in the 1930s. Very specific government policies, high taxes, high regulation, and programs like that. That's why we had poor people in the 30s that greatly exploded, because of failed government policy that always fails. Government spending never works to bring on a strong economy. So the answers for the poor are a strong economy, helping the poor locally, private charity. It's not the government welfare state. It has been a total failure wherever it has been tried, whether in the United States or around the world. So thanks for joining us today on Mark Robertson Talks. We'll see you next time.